Welcome to this week's episode of LDN ONT TV on Rogers Television London. I'm your host, Bronagh Morgan. It is Mental Health Week, and when you're watching this show this week, premiering anyways, we're about 2/3 of the way through the most recent stay-at-home order. So I think maybe we're all facing some mental health challenges right now that are unique, maybe stuff that we've never gone through before. I am really, really happy to say we have a fantastic guest with us this week to talk about mental health, somebody who's been committed to, furthering the interests of people who are struggling with mental illness, with addictions for many years, a lot of time during his career. And now he is the Associate Minister of Mental Health for Ontario. His name is the Honourable Michael Tobolo. Welcome to LDN ONT TV. Thanks for being here.
Hi, Bronagh. Thank you for having me. This is a wonderful opportunity for us to speak, and I look forward to talking with you.
Well, I'm really glad to have you here. So you are a member for Vaughan Woodbridge, I believe,
Right.
Which is in the York region. And I think York has had maybe a similar experience to London in terms of the amount of time you've been in lockdown.
Yes.
And obviously we're all in Ontario right now in the stay-at-home order. Obviously, you have a unique perspective as the Minister of Mental Health and Addictions about the impact of something like a stay-at-home order, especially over a year now into the pandemic. Can you talk to me a little bit about, your experience, maybe personally or in your community in Vaughan Woodbridge, and even as you visit Toronto, how are people coping?
Yeah, it's a very difficult time, very challenging time for everyone, regardless of the age of the individual. So we see children that are having difficulty because of the fact that they're not in classrooms. You see changes, mood changes, eating issues with respect to their routines. You see situations like that with our teens. We've had 110% increase in calls to our kids' helpline. So we know that it's having an impact on our youth. The opioid crisis, we're seeing that there has been a 56% increase during the pandemic with respect to overdoses. We are managing, it seems, our suicide rates, although we're seeing a huge increase in eating disorders, which is something that is very troubling because it affects mostly young women between the ages of 13 and 24. We're seeing seniors that have been in lockdown, isolated, not able to see their families. I haven't seen my mom. I went to her house just the other day to just look in the door, knocked on the door, and I saw her on the other side, and I went to open the door and she says, "Where's your mask?" So, obviously she's very afraid. And our seniors are all very afraid. And that's no different here in Vaughan Woodbridge. It's the same situation in London. It's the same situation pretty well everywhere throughout the province. And then, of course, we also have all the marginalized communities that have similar situations of being afraid, trying to ensure that they maintain social distancing, but there's a cost associated with all this. And it is impacting everyone in society, not just one sector.
I understand it's almost, I think it's what some people call the shadow pandemic, because obviously COVID, it's a real risk to people's health. And I think we all either know of, or maybe even somebody in your family has, experienced the actual physical, the illness that is COVID. But I think we all also know somebody who is going through a really hard time as a result of the way we've responded to COVID. And so I think that's something that's really important to you, and you're probably uniquely positioned to talk about this, is how do we balance keeping people safe from a physical, like a medical illness, and how do we keep people safe from mental illness? So how do you, what kind of plans, or how do you kind of strategize about how to balance those two extremely important things?
Yeah. See, that to put it all in perspective, when we started talking about mental health and addiction issues, as they relate to the pandemic, one of the things we have to remember is that we were in a mental health pandemic before the COVID pandemic hit us. That's one of the reasons why the government appointed me as the first Minister for Mental Health and Addictions. We recognized that there was a problem. In addition to that, prior to the pandemic, the government, both the federal and the provincial government, came together, and we have a fund of $3.8 billion to invest over 10 years. We always talk about there being problems for access to a system. The fact that there is no system because it's so fragmented and there's so many gaps, the fact that some services are available in London, but for other services, you'd have to come to Toronto, or if you're in the far north, you'd have to come to Southern Ontario. So there really was no system. And so we started with the roadmap to wellness. We created a center of excellence that could establish policy and measuring tools to know that the things that we were trying to do were being done properly. And we started making huge investments. We're investing $525 million a year now in annualized funding to help further develop a plan and a strategy. So it impacts on our young people. It impacts on every sector within society. And COVID-19 really has forced us to be very aggressive in doing certain things like virtual supports. So I can tell you that at this point in time, over 60,000 people in the province of Ontario are using internet-based cognitive behavioral therapy, which is available free of charge to anyone who needs it. Likewise, we also have established programs that are specialized for our first responders, because God bless them for the work they're doing. They need supports too. It's not an easy job to be doing what they're doing under the circumstances. So COVID-19 has forced us to really enhance a lot of services. We've made incredible investments, huge investments, even during the COVID-19, an additional $194 million specifically to community-based organizations, because they're doing a lot of the heavy lifting in the province by providing supports and services to individuals. Still, though, we don't have full capacity to do everything because of the lockdown. And so what I always tell people is you've got to look to build that resiliency yourself. Your kids, you got to give them the opportunity to go outside, in the backyard. And if you don't have a backyard, to be able to go to the park with a mask, without a mask, depending on, again, the social distancing. We've got to be cautious about the things we do, but we have to establish a routine with our kids, and we have to give them the opportunity to live, to have the environment, to have that cognitive development that they desperately need during those initial years of life. But we have to be creative, and I recommend, actually, I would say, I implore anyone watching this to look at doing things. Some of the things that are going to come out of this is the fact that a lot of family units have developed relationships that perhaps weren't there before, because we're being forced to be at the same table, one doing their schoolwork, one doing their business. Unfortunately, it has also highlighted some of the domestic violence issues that have become exacerbated because of the situation. But we need to work hard during this time to really develop new routines to ensure that we keep our mental wellness or keep our mental health in check, I guess.
And that is something I think, if there is a bright spot, is that level of interaction that some people, like my family in particular, has been able to kind of build over the course of the last year. So not a lot of bright spots about some of the things we've been through that last year, but thank you for recognizing that one. We're going to have to take a break, and we're going to be back with more with Minister Tobolo after the break. Welcome back to LDN ONT TV. I'm Bronagh, and I'm still speaking with our Associate Minister here in Ontario of Mental Health, Michael Tobolo. So welcome back. I would love to talk to you a little bit more about the fact that you are, taking care of this portfolio that really didn't exist prior to you taking it on. So you're kind of running with this. It is so important, and it's nice to know that the government over the last few years has recognized the significance of mental health to health. why is this something that you wanted to take on when the premier came to you and said, here's a new portfolio for you? Because I know you were in, I think, community services and corrections prior to this.
Yes, and that's a good question. It's a long question it's a long answer, but I'm going to keep it really short. I came to government because of the work that I did as a volunteer in an organization in Southern Ontario, a residential therapeutic community for men that suffered from addictions and concurrent disorders. I tried when I was volunteering in that organization. I actually was a lawyer. I practiced law, and my background is political science and economics. So you'd say, like, how did you end up in this portfolio? Well, it's because of the work I did in that organization and the fact that community-based grassroots organization, like many of the ones that exist today, that if you needed help pretty much in any part of the DSM-5 disorders, you'd find that it's some mom or some dad or some couple or some kid that started an organization to raise money to actually provide the supports that the governments never seem to be able to get straight and invest in. So I was doing my work. I have a 5th degree black belt in Taekwondo, and I was traveling the world as part of my work for the Federation and teaching the Do of the martial art, which is the art of living. It's the reason behind why martial artists have a philosophy that's different, and it's based on Taoist thinking, Taoist philosophy. So I would teach, and I taught everywhere, 54 countries around the world, including Ireland and some African countries and Europe. Anyways, as part of all that, I came to this organization as a volunteer to do a motivational talk. And I started to see the potential in the guys that were in the room and thinking these guys need help. And then I learned about their budget and how they were fundraising, needed to fundraise. It was being run by a priest. And the priest basically had a nervous breakdown, which resulted in a void in the organization. And he asked me to take over. My work led me to government begging for money to help the work, and it wasn't forthcoming. I eventually sat down with one of the ministers who basically said to me that I didn't know what I was talking about, and that there was no money in government to help people with addictions and mental health. And I said, I will take your job one day. And I did. And what prompted me to do it was not just the fact that I saw the potential in the individuals. 2 of my very close friends had sons that were addicts. And both of them lost their sons, but one in particular became almost like a son to me. And after 18 months being in the program, he thought he was okay. He left the program. It was a 24-month program. And every month does count. Every day for an addict does count. So to cut the program short, the likelihood of success in the program is reduced by the number of days that you're not in the program. And the individual, went to a crack house and ended up getting high, ran out into the middle of the street and was run over and was killed. The other one lost his son because we couldn't find a withdrawal management bed for him. And there was, at any given time in this province, there was a 6-week wait to be able to get someone in. So I decided at that point that my career was important to me, but that there were other things that were more important. And that was to look at the system, overhaul it, and build a new mental health and addiction strategy. So I came to government, and the first portfolio I got was community safety and corrections. And I got a chance to see how bad it was for police interacting with individuals that should never have a police officer interact with them. They need to have a person who's trained as a nurse practitioner, as a social worker, to be able to diffuse the situation. London had a great program then, the mobile intervention crisis teams, and Toronto had some. So I saw the opportunity there to do something to change that, to reduce the interactions. I also saw police officers and first responders that were being put at incredible risk because of the potential for trauma related to the work that they were doing. I saw that they weren't getting the proper training. So I went to corrections and I visited the London facility and saw the abhorrent conditions that these individuals were facing, where they weren't getting the supports while they're in correction. So what were we correcting? Anyways, make a long story short, I got moved out of that portfolio, not to mental health and addictions, but to tourism, culture, and sport. So I became the minister responsible for these things. And in the process of being the minister, I was invited to a conference in Rome at the Vatican. And I'm sitting in the audience and I'm listening to presentations from around the world from different people that are working with young people that have addictions and mental health issues. And the Pope saw my name on a list. And he said, the minister for sports, heritage, and culture. So he called me up. And so I chatted with the Pope for about 5 minutes. And in that 5-minute conversation, he said to me, you have the most important job in government. And I, like, what's he talking about? And he said, you work with kids and you provide them opportunities through organized sports, team sports. And as a result of that, you're giving them the ability to learn the skills that they need to be resilient and to stay away from the use of substances to deal with problems. And it really hit home at that point. Well, I came back, and of course, my advocacy work at Cabinet was always around mental health. We all saw the need because 16 different ministries have a component of mental health. And, I believe Premier Ford made a very wise choice in creating a ministry, and an even more wise choice in giving me the opportunity to serve as the first minister for mental health and addictions. That's how it began. I mean, the details of it are a lot more than that. You can imagine when you're in a sector and you're fighting to try to help individuals and you see them pleading for help, and they're in circumstances that they're there not because they chose it. And that's the one thing that I was always a really sore spot for me, is when someone would say to me, but he chose to be an addict. That has always bothered me, because nobody chooses to be an addict. What ends up happening is that the influences of, the attachment issues, what's happening in the family between that child and the parents, and how is that impacting on the child? We know statistically that 70% of all mental health issues that we see in adults could have been dealt with because they developed during the ages of youth and child and youth years. So we're talking the ages basically of birth to the age of 24, in that time frame. So the importance of a sport, of having those opportunities, not only for the kids, but adults as well. Our mental health, without mental health, how do you get educated? Without mental health, how do you go to work? Without mental health, how do you have a relationship with your spouse or with your kids? And if you don't have those things, we're perpetuating a problem that will eventually come back to haunt us later on. And that's why we've got corrections facilities with 30%, 35% of the population with a mental health issue. They don't belong in corrections. They belong in a program where they will get the help and the support they need so they can live a fulfilled life. And that is important because it reduces the cost of government, but more importantly, it gets more people healthy, more people safe, and provides them, what you and I want, a better life, the ability to enjoy the blessings we have in this province and in this country.
Your passion for mental health, for serving the people of Ontario is so refreshing to hear from somebody who's been in politics for a while. And the child-centered approach that you take, obviously that's a big part of our show and why we do our show in the way that we do. So it's so appreciated. And I wish we had another half hour or maybe a couple more hours to talk, but I just want to say thank you so much for being here, talking about the things that you're working so hard and so passionately on behalf of all of us in the province. Keep it up. And I hope that you are doing everything that you can to keep yourself mentally strong and healthy so you can keep on serving us here in Ontario. Thank you so much, Minister Tobolo, for being here.
Much appreciated. And I look forward to future conversations.
Welcome back to LDN ONT TV. We've been talking about how the pandemic and being separated from people has really had a serious impact on youth. So I'm really happy to welcome to the...
Hi there. Thank you for having me.
Well, thank you so much for being here. I know that you, obviously, as a young person and somebody who's involved in the community, have been experiencing these challenges that we've been talking about, what have you been doing to help keep people connected in these last really challenging, I think, going on 14 months now?
Yeah. So I'm a part of a youth organization run by Luso Community Services called Yolo Youth, Organizing Leadership Opportunities. And even through the pandemic, we've decided to continue what we do best, which is connecting young people with their communities. So although virtually, we're continuing to host our events and meets and just trying to engage youth with their community in the best way they can with everything going on.
So what kind of events can people get involved with if they're watching right now? So if it's a grown up or if it's, some kids maybe that hopefully are watching our show as well, how do they get involved and what kind of things could they expect if they got involved with Luso and your community?
So YOLO is open to any volunteers around the ages of 12 to 19. So if you're looking to get involved with the community, need something to do on a Friday night, or just want your volunteer hours, YOLO is the perfect place for anyone. And our events are mainly for the community, families, youth, anyone who just needs a way to connect with people at a time where that could be really challenging.
So what kind of fun things do you guys get yourselves up to?
So recently we've been hosting monthly trivia nights where we get prizes and donations from local businesses that, even though they're suffering during the pandemic, have graciously donated to us. So we can keep our trivia nights as interesting and as engaging as possible. We also host murder mysteries where our YOLO members will take on the initiative to act as these crazy and eccentric characters and have our audience try to guess who is the mastermind behind a crime. We've also been thinking that because mental health is such an incredibly important topic, especially during this time, that we would be hosting contests and more engaging content through our social media pages to engage different communities and different groups that maybe have different interests we haven't touched upon yet.
So have you seen an increase in engagement with the young people in the community over the past year?
Oh, definitely. At the beginning of the pandemic, we didn't even meet for the first 2 months. We kind of all stuck to ourselves. Everyone was really confused about the whole situation. But by the summer, it became clear that it wasn't going away anytime soon. So we decided to pick it back up and start meeting again. And we finally figured out what we wanted to do virtually by November. And we started having game nights and more creative content in the works. And from then on, we had maybe 2 or 3 community participants, which was still such a big deal for us who haven't planned an event in such a long time. And now we're reaching close to 12 and 13. And our goal is to have as many people as possible come in and join.
And anybody can join, obviously, regardless of where they are in the, in the Southwestern Ontario region. How do we get, how does somebody get connected?
So we primarily run on our Instagram page at YOLO London, and all of our posts and events are all promoted there. So if you ever need the Zoom link or more information to an event, the best way to get in contact with us would be through there, or an email address that is also posted on the information post.
Great. And then I know you're doing a fantastic job with the constraints that we have right now. And obviously, one of them is not being together. What are you looking forward to the most when we actually can get back together again?
Oh, at a time like this, that seems like a dream, honestly. I think the most important thing I'd want to do is hug my friends. I just want to give everyone a big hug. I miss being able to just smile with them. I miss being able to laugh comfortably with all my friends and meet people without the fear of COVID. I think I just want to see everyone smiling and laughing, all happy again.
Yeah, I think that's going to be a great day for all of us, and hopefully sooner rather than later. Thank you so much for telling us about all of the awesome things that you're involved with in the community, Chinmayi. And I'm sure that we are going to, have a lot of people wanting to engage with you, because there is a real need to engage right now with people in the community. I think we're all feeling, a lot of fatigue, and, the best thing for our mental health is being with each other. I think that's probably something that we can all agree on. So thank you so much for being here. And thank you for tuning in this week to LDN ONT TV. I'm your host, Bronagh. I hope you'll join us again next week.